Well, we've talked about the increasing number of mosquitoes with all the floodwater.
And that, of course, brings with it the increased risk of West Nile virus. Jody Baker live with us this morning to explain the concerns that we should have and what we can also do to protect ourselves.
Good morning, Jody.
Good morning, Jim and Cerise. So West Nile doesn't usually pop up until the end of July, and while there have been no official diagnoses yet in humans in our area, mosquito pools here have tested positive, and a few patients have come down with West Nile-like symptoms. While health officials await test results to see if that's actually what they have, they recommend we all start taking some precautions. Cleaning her car in the afternoon, Darlene Price is trying to avoid the peak times for the mosquitoes that have been buzzing around her neighborhood near the Missouri River.
I think if you were out in the evening, you probably would get bit pretty bad.
But that may not keep all of the waterborne pests away.
Some species of mosquitoes also bite during the day, so it's advisable if you're going to have to be outdoors for any prolonged period of time, especially at night, to use a mosquito repellent.
Dr. Robert Penn specializes in infectious diseases for Methodist Health Systems and is watching for West Nile.
Peaked in 2003, and then since 2006 there's been a steady decline, but we're concerned that maybe with all the floodwaters that you've referred to, we may be seeing more cases of West Nile virus this year.
Most people infected don't even realize it, and they do get immunity.
Versus about 20% of patients may have a spectrum of disease ranging from a fever and headache and body ache,
all the way up to neurological infections like meningitis and encephalitis. Those over 50 with diabetes or compromised immune systems are most at risk.
I think that is a concern, because if the bugs bite you, you really can get deathly sick from it.
While those around here can't do anything about the Missouri's overspill, they can eliminate stagnant water in their own yards, like bird baths. Something else is also helping their fight, an increase in frogs and swallows feasting on the added insects. Even spiders are welcome around here these days. Now, there are several types of mosquito repellent. Keep in mind, Dr. Penn says that DEET products should never be used on children, babies less than 2 months old. When it comes to children, family-friendly sprays like this one are good. And he says that adults should first apply it to our hands and then go ahead and rub it on the arms, legs of children, and also cheeks, but avoid the eye areas. That's important. And when it comes to, this type of stuff, you can really never be too careful because Jim Cerise says, we all know little kids can often put their hands in their mouths and they'll be touching other things too. So you don't want this to end up there.
That's true, Jody. Let's talk about the incubation period from the time we get bit maybe by a mosquito until an actual infection with the West Nile. What's the time period there?
Well, the incubation period is about 2 days to 14 days. Anywhere in that time frame from when you get a mosquito bite, you could potentially come down with symptoms. But the actual test results as to whether or not somebody has it, they could take 5 to 7 days to come back.
All right, good information. Thank you so much, Jody.
Time for another check of our time.